Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about the next step in the process of managing peripheral neuropathy. So with peripheral neuropathy, we're going to actually take you through 4 steps. The first step, of course, was understanding peripheral neuropathy and understanding your individual peripheral neuropathy, which is what we've been done to this point. The next step is to manage the peripheral neuropathy symptoms, primarily pain, because that's the biggest symptom. That's the biggest problem that most individuals will have. And so managing pain is that next step, and there are 4 buckets of ways that you can actually treat managing pain. And so we're going to start with the first bucket, which is nerve re-education. Now, in saying that, the most common re-education that we use is a form of electrical stimulation called Calmer. There are certain machines that will actually send signals through the nerve, and they will actually stimulate the nerve to function like it's supposed to. So the problem with the nerve is it's sending the signals incorrectly to the brain. And because of that, the brain is interpreting it wrong. So a touch can be interpreted as pain. A sheet can cause severe discomfort because the brain doesn't know how to interpret it, and it's interpreting it as pain. And so with that being said, through this process of electrical stimulation, we're actually stimulating the nerve to function like it's supposed to, stimulating the signals to flow through in a way so that the nerve starts to understand how it's supposed to be sending the signals, and the brain starts to understand what the normal signal is. And this is a very common way to re-educate the nerve. The truth is, we have another machine that we sometimes use that is very valuable at doing another type, but it can also work in re-education, and that's the rebuilder machine. The rebuilder will re-educate the nerves in some respects, not quite as well as Calmer, but it does re-educate the nerves, while it also does repression, which we'll talk about in a couple of days. So nerve re-education. Now, there's a part of nerve re-education that we commonly don't talk about because this re-education actually happens through a process called neuroplasticity. And basically what it is it's the process of nerves will change, nerves will modify, nerves will do what they need to do over a period of time based on the way that information is flowing. So in the brain, neuroplasticity causes different parts of the brain to start to communicate and create loops so that you can actually function and you can actually do things over and over again. It's a process that creates habits. It's a process that you'll get individuals that may have Alzheimer's or other disease processes that are making the brain not function correctly, but they can still go to the kitchen and know how to find food. They can still go on a walk and make it back home because they just have these loops in their brain from neuroplasticity that makes them function more like they're supposed to. So the process here is through neuroplasticity. You can also teach the nerves to function more like they're supposed to through different types of things, whether it's through the electrical stimulation like the Calmer is doing, whether it's through a rebuilder machine and counteracting the pain and so forth to actually help that nerve again function like it's supposed to, or whether it's true neuroplasticity, which happens through processes such as self-hypnosis or through processes such as unhackability, which we're going to talk a great deal about here in a week or so. But the point is, if you teach your brain to function a certain way, and if you start to get the processes in place so you're functioning a certain way, and you're thinking a certain way, and you're expecting certain things, and so forth, the nerves will start to function more that way as well. So if you focus on the negative, the pain, and so forth, the pain will increase, and the neuroplasticity will cause the nerve pain to increase. Am I telling you that you can talk yourself out of hurting? That is not completely true. But looking for the positive and looking for the good, you will find what you're looking for. And so the point is here to give yourself every chance you can to improve your peripheral neuropathy and the symptoms you're having with your peripheral neuropathy through the process of neuroplasticity. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget Day 163, managing the symptoms of peripheral neuropathy, managing pain.